The U.S. has said it will not use the Russian ventilators sent to it by Moscow while an investigation is carried out into their safety, following a deadly hospital fire in St. Petersburg on Tuesday.
The U.S. Federal Emergency Management Agency (FEMA) told CNBC Wednesday that it would not start using the Aventa-M ventilators after they were cited as the possible cause of a fire in the St. George Hospital, in St. Petersburg, that killed 5 patients with COVID-19.
The victims were in an intensive care unit and on ventilators at the time of the incident. Russian news agencies reported 150 other people were evacuated from the hospital. Sources at the hospital were reported as saying that the fire could have been caused by one of these ventilators short-circuiting.
The St. Petersburg hospital fire follows a similar incident last Saturday in a hospital in Moscow that was also treating coronavirus patients and also using the same model of ventilator. The fire killed 1 and forced hundreds of others to evacuate.
Russia has now suspended the use of Aventa-M ventilators throughout the country, Russia's health care regulator Rosravnadzor confirmed Wednesday. It said Aventa-M ventilators were used to provide medical care to patients at both the Moscow and St. Petersburg hospitals.
FEMA, an agency of the U.S. Department of Homeland Security, confirmed to CNBC that the same model of ventilator had been sent to the U.S. from Russia in early April, during a scramble for medical equipment as the coronavirus pandemic raged in the New York area.
At the beginning of April, Russia sent a shipment of medical supplies, including Aventa-M ventilators, to the U.S., a FEMA spokesman told CNBC.
At the time, a severe ventilator shortage was projected in New York, NY, and New Jersey, NJ, so the ventilators were delivered to warehouses owned by the 2 states.
The spokesman said that a flattening of the infection curve meant the ventilators were not needed, but were held in reserve in case the situation worsened. The ventilators have not been deployed to hospitals, he added.
FEMA told CNBC that out of an abundance of caution, the states are returning the ventilators to FEMA, and added that the conclusions of the investigation being conducted by the Russian authorities into the fire in St. Petersburg will help inform our decision regarding any future use of the ventilators.